Hi, Dr. Laila. How are you doing?
Hi Farah, I'm good. How are you?
I'm fine, thank you. I wanted to ask you a few questions about your career. Are you okay with this?
Yeah, for sure.
Okay, let's start. The first question says, can you introduce yourself and tell us what do you do as a therapist?
Okay, my name is Laila. I'm a 24-year-old. Um, I do therapy. I'm a clinical psychologist. I do therapy using cognitive behavioral therapy and other forms of therapy, which is what's mainly known as talk therapy to treat various mental health issues and
Okay,
disorders.
that sounds really interesting. What's your favorite part of your job?
Actually, my favorite part is getting to meet new people and seeing how therapy can influence the life of a human being. So, from a person coming to me with a really severe problem, and a person who doesn't know how to function in their daily life, getting that person to be a functioning human being in the society is a very rewarding thing to do.
Okay, let's go for the second question. Why did you choose to become a therapist? Was there a moment that made you love this job?
Yes, actually, I've always wanted to do therapy and like psychology in general. I find it very interesting since I was in middle school. And then my psychology teacher in high school, she made me love the subject. She was
Mm,
such a lovely human being. So this motivated me more to get into psychology.
okay. Question three. How does science help you in your job? Can you give an example?
Actually, science does play a huge role in understanding psychology and understanding human behavior in general. So, understanding how the brain works and the neurology of the brain is a very fundamental thing. So you can know how to treat the person with a mental disorder. So, although I don't prescribe medication, but just knowing about how the brain works and what certain areas of the brain are impaired due to the disorder is just very insightful and very helpful for me to try and treat that patient.
Okay. Um, Question four. What is one common mental health problem you help people with, and how does science guide this treatment?
Various disorders, actually, including like the most common one, which is depression. So, depression is mainly uh, you get to understand depression from a biological point of view, which is how serotonin, which is a brain neurotransmitter, is like has a deficiency in the brain. So, that person tends to have depression because of this like impairment in serotonin. So that's when I know that I need to refer my patient to a psychiatrist to prescribe medication. So understanding the biological perspective or the biological side of any disorder is so important, so you know who which patients you should refer to a psychiatrist and who don't need a psychiatrist to be involved.
Okay. That's really cool. I didn't know this. Uh,
Yeah.
Question five. What kind of education and training did you need to become a therapist?
You first need to do a bachelor's degree in psychology, and then you need to do a master's degree, which is actually what I'm doing now.
Where?
I'm doing a master's degree in the UK in Swansea University,
Oh, okay.
specifically in clinical psychology, because this is what I want to approach in my field.
Mhm.
That's like the two main things, along with like trainings in mental health facilities and hospitals, and of course you can always continue your education with a PhD. So we'll see if this can happen in the future.
That sounds like a long journey.
Yeah, it is. It is. Tell me about it.
Okay, let's go for question six. What are the most important skills someone needs to be a good therapist?
Oh, that's a very interesting question. Okay,
Hmm.
so I think, um, like in my own personal opinion,
Hmm.
three main skills should be there in a successful therapist. One is being an active listener, which is not just listening to the person, but like fully understanding what the person is saying and not saying at the same time. So active listening is a very important skill.
Mhm.
Another skill is empathy. You need
Mhm.
to be empathetic, not sympathetic on the other side, because if you tend to be very involved in the patient's or the client's emotions, that's going to stop you from helping them. So empathy plays a very huge role. And I think being non-judgmental, although it's not actually a skill, but it's something that any therapist should have, because every client needs to feel like doesn't need to feel judged.
What about patience? Do you think patience is an important skill?
Um, I think when you become empathetic, you eventually be patient by time.
Okay. Question 7. What advice would you like to give to young girls who want to work in therapy or psychology?
I'd advise them that to keep going. It is a long journey, like you said,
Mm-hmm.
but it's a very interesting one and it's a very rewarding one. So I advise them to keep going and to try as much as they can to find hands-on experience in trainings, in internships, before they do their like master's degree, because this just gives them an extra boost.
That's a great advice. What do you wish someone told you when you were little or when you started it?
Oh, I wish someone taught me something. I wish someone taught me how to manage my time
Mm-hmm.
and how to put boundaries on for myself in order not to be um, too emotionally involved, because that will leave me drained at the end of the day. So yeah, that's something I wish I had learned before.
Okay. Last question. If you could go back in time, would you still choose this career and why?
Yes, I would definitely still choose this career because I'm very passionate about it, and because a lot of people need help, not just help in situational problems, but more in-depth help in understanding their own emotions and their inner struggles. And there are not a lot of people who are willing to do this. So I would definitely still do what I'm doing.
Okay. Um, that's it. Thank you, Dr. Leila, for the chat. Uh, we appreciate it. Thank you.
Thank you. Bye bye.
Bye-bye.